This program is brought to you by the Neely School of Business at TCU, Community Trust Bank, Medical City, and Bid Select. Welcome to Platforms, the life-lifting news program for women. Now, here's your host, Siobhan Palmer.
Hey, welcome back everybody to Platforms, the life-lifting news program for women. I'm here with Dr. Lise Labiche at Medical City, Dallas. When we went to break, we were talking with Dr. Labiche about a magnificent new medication that prevents or breaks up clots for stroke patients. Dr. Labiche, I know that you're very passionate about education, particularly for families of stroke victims. Tell us what kind of program you have here at the hospital.
Well, with regard to patient and family education, it's critically important for patients to understand why they've had their stroke and what they need to do to prevent further strokes. Within the United States, almost 800,000 strokes occur annually, and almost 200,000 of those are recurrent. And so it's very important for patients and families to understand their risk factors, why they're on the certain medications, and the need for follow-up. So we actually have binders that we put together with all of this information that we go through verbally as well as give them to take home so that they don't forget it.
What is the first symptom, generally speaking, that somebody experiences just prior to an attack or a stroke?
That's the difficulty, is that strokes come out of the clear blue sky, and it's not until that blood clot gets stuck in the vessel or the blood vessel ruptures that you have any symptoms whatsoever. And it's at that time that you develop typically weakness on one side of the body, numbness on one side of the body, slurred speech. Now, up to 15% of people do have what's called a TIA in the weeks before their stroke, and that is the same exact symptoms as a stroke, but they go away completely without any deficit. Trouble is, half of the people who have a TIA never seek medical attention. They don't even tell their regular primary care doctor, and that's the time that we really need to intervene to prevent a more serious attack.
I think that's key what you're saying. I had a family member who suffered a series of TIAs during a family wedding, and she, thank goodness, went to her primary care physician. But you're saying essentially if people, that's a warning sign, so to speak, and if you really don't follow up, then you could have the large stroke.
That's exactly right, and what's really disconcerting is that 38% of the population know the signs and symptoms and know to call 911. That means more than 60% of people don't know all of the signs and symptoms. They don't know that they should call 911, and the elderly population as well as minorities who are at the highest risk know even less so than that.
Let's talk about, here at Medical City, Dallas, you have a really neat program called Stroke Hero Awards. Tell us about that.
Well, what we do during EMS Week, which also coincides with Stroke Awareness Month, is that we reunite patients who are treated with the clot-busting medication TPA and who recovered with the paramedics who actually transported them in. And that's so important because when every minute is 1.9 million brain cells, we need to bring the paramedics into this whole system because what they do in the field is really important. It also allows them to see how well patients can do when they receive timely treatment, and it really empowers them.
Is there a particular patient you can think of that really impacted you professionally or personally as a result of treating?
Well, there's so many, but just even within the last year, I took care of a gentleman who is an international law attorney who had a very severe stroke syndrome. He fell down to the ground with left-sided weakness. He did not realize that he was having a stroke, and it was sort of a good Samaritan who passed by, saw his legs sticking out, who called 911.
Now, where did he suffer the stroke? Was he
at his office?
At his office.
At his office, and he basically begged them not to call 911, and he actually came in. He could not move the left side of his body, wasn't even aware that it existed, and he received the clot-busting medication within 22 minutes of arriving to the hospital, which is absolutely outstanding, and he basically had a full recovery. I received pictures of him last Christmas with his grandchild getting his first shoulder ride with Grandpa, and a letter from him stating that he was on his first overseas trip by himself. And so people really can go back to life as they knew it before if they get in quickly and get treated appropriately.
But again, that timing is so critical, isn't it?
It's so important. It really is. And the thing that is most common for people to do when they develop signs and symptoms of a stroke is to go to sleep. And it's usually the sort of the mean time that it takes for people to present is over 15 hours, and then it's just too late.
Oh my goodness. Let's talk about the connection between one's diet and the incidence of suffering a stroke.
Sure. Well, diet's really important because it can lead to high blood pressure, diabetes, high cholesterol, basically all of the risks for stroke can be associated with diet. There have been studies done that look at healthy diet, regular exercise, abstaining from smoking, and maintaining a good healthy body weight, and the incidence of stroke goes down dramatically with those very simple measures.
I noticed too that one of the areas of education you have here at Medical City Dallas is educating the medical community, which, why don't you describe what that is? So you're talking about other physicians that don't specialize in this area, you need to get them tuned into what's going on so they can work with their patients?
That's exactly right. Because the national treatment rate with the clot busting medication is only 2 to 4%, tells us we have a lot of work that needs to be done. We need to bring to the forefront how prompt treatment is really important, and that's been our emphasis here at Medical City, whether it's paramedics, emergency physicians, nurses, the whole gamut. Is that
so it's all frontline personnel that you're trying to...
All of the front line, but you know what, we also include within that the CT techs, the lab techs who draw the blood. Everyone's role is so important in getting done all of the things that need to be done before we give the clot busting medication, and I think that it's really the big team effort that leads to better patient outcomes.
I know that you, going through medical school, you had many specializations you could have embraced. So why this particular area of medicine? What was the appeal to you?
Well, it's interesting. I loved neurology, but I didn't love stroke. I didn't know much about it. And I ended up in a training program that was one of the biggest stroke programs in the country. And I'll never forget being an intern, and a patient came in completely unable to talk, couldn't move the right side of the body at all, and literally within 10 minutes of giving the TPA, the patient started to speak and started to move the right side of the body, and never had I seen anything so dramatic that truly impacted someone's life. And from then, I changed from Alzheimer's disease to stroke, literally on the spot.
The TPA medication, how long has it been in existence, and has it really revolutionized the treatment of strokes in this country?
It has. The pivotal trial that was performed was in 1996, and so it's been available since that time. And in a sense, yes, it has revolutionized treatment. It's brought stroke to the forefront as a true emergency or as a brain attack. Unfortunately, it's not widely utilized because patients don't recognize their symptoms, they don't come to medical attention, and unfortunately, there's still a large amount of the medical profession who hasn't widely embraced its use. And so that's the reason and the need for primary stroke centers, so that patients can be brought to centers capable of providing this life-saving treatment.
Have there ever been any studies that indicate that a higher incidence of stroke in populations might be due to environment? You know, is there, whether it's weather or stress levels or high populations or anything like that?
Sure. Well, there's a lot of different theories out there regarding incidence of stroke. What we do know is that there are certain minorities. African Americans and Mexican Americans are both at much higher risk than our Caucasians. Part of that may be genetic, part of it environmental. We know that there are certain times of the year that stroke are more prevalent, and even certain times of the day in early morning hours. But there's still a lot as far as the causal relationship that we have yet to prove.
Just to wrap up, we've got about 30 seconds, Dr. Labiche. Goals for the program here at Medical City, your personal goals for the program in the next, say, 4 or 5 years.
Yes. Well, right now we're in the process of becoming a comprehensive stroke center through the Texas Stroke Institute, and with that we'll be able to offer all of the acute therapies, including delivering the drug right onto the site of the clot, and we also are developing a fellowship for training of interventional fellows who do these cutting-edge therapies. We're starting to participate in research trials, and so we really want to become the regional center for stroke care with national recognition because of our training opportunities, our treatment rates, and our research.
Dr. Labiche, it's been an absolute pleasure having you on our program. Ladies and gentlemen, this is Siobhan Palmer with Platforms, a life-lifting news program for women. We'll be back in a moment.
The Texas Stroke Institute is dedicated to compassionate, multidisciplinary, and quality care for patients who suffer stroke and disorders of the head, neck, brain, and spine. Physicians at TSI offer patients cutting-edge treatment options for neurovascular disorders, including minimally invasive catheter-based therapies for adults and children. TSI encourages academic and research excellence, community awareness, and prevention education. The Texas Stroke Institute is a collaborative initiative that includes 11 North Texas HCA hospitals. The goal of TSI is to develop an effective and resource-efficient plan to reduce the morbidity, mortality, and economic burden of stroke in the region by incorporating medical education and participating in research. Texas Stroke Institute physicians practice multidisciplinary medicine to drive best practice in patient care. Their vision is to become the first system in the North Texas region to offer multi-facility comprehensive stroke care. Texas Stroke Institute, Dallas, and Plano. For more information, visit texasstrokeinstitute.com.